Hi, I'm Kate Harrison, a Board Certified Behavior Analyst with Brett Dinovi Associates. Have you ever struggled with public speaking, specifically adding a bunch of unnecessary likes or ums during pauses when you're trying to figure out what to say next or when you're nervous? Then this video is for you. In our profession, we're in communication with our client, their families, and other professionals like a speech therapist, occupational therapist, an IEP team, teachers, doctors, and many other professionals. In order to work together and to meet the needs of our clients, we must be able to effectively communicate what we're doing and why we're doing it. Verbal fillers such as like, you know, and are something that everyone relies on, especially the younger generations. According to communication experts, these phrases occur frequently when we're trying to think of what to say next, especially when we're nervous, perhaps while giving a presentation, conducting a training, sharing information in an important meeting. Given that our field is still very young, we have an opportunity and an obligation to do our very best to effectively spread the science. While we may have important information to share, we're going to lose our credibility if we're unable to effectively communicate. Not only this, but excessive use of these filler words and phrases and sounds is distracting for the audience. For these reasons, research should be conducted to decrease these habits. Habit reversal is a multi-component procedure typically presented as a package of numerous individualized treatments, implemented to achieve significant reductions in habit behaviors. Research supports habit reversal for behaviors including tic disorders, stuttering, and common nervous habits such as nail biting, hair pulling or twirling, thumb sucking, teeth grinding, and object manipulation, among many others. Due to the success in significantly decreasing stuttering and other habits, Carolyn Macuso and Raymond G. Miltenberger applied a simplified habit reversal treatment to participants who engaged in filled pause behaviors in their 2016 study. A non-concurrent multiple baseline design was used to evaluate the effectiveness of a habit reversal procedure to reduce filler phrases during public speaking. Participants in this study included 6 female college students who rated their public speaking skills as average or below average, and each exhibited use of filler phrases at least twice per minute during their public speaking activities. Target behaviors included filled pause, which occurred when a speaker uttered a nonsense syllable such as and like, which was considered a filler in an instance when it was not grammatically appropriate to use it. So for example, not making a comparison or used to indicate enjoyment. Tongue clicking, which was defined as any instance in which the speaker placed the tongue on the roof of their mouth to create a clicking sound. Data were collected via video recording for both baseline and intervention assessment. All sessions included a 3 to 5 minute speech, and frequency within 15-second interval recording data was collected on these target behaviors. Social validity was collected by means of 2 surveys, the first in which collected information on their ability, comfort, and confidence in public speaking prior to the intervention, and the second in which evaluated the acceptability, satisfaction, and ease of the intervention. During baseline, participants were given the choice of topics and asked to use 10 minutes to prepare their 5-minute speech. Data were collected and no feedback were given in the baseline phase. Habit reversal consisted of an awareness training which had 2 components: response description, in which the researcher and the participant discussed the topography of the target behaviors that I mentioned earlier, and response detection. This is when the participant and the researcher detected the behaviors in the video of baseline, and they practiced detecting these behaviors while they were giving a speech in which the participant was instructed to raise their hand at any point in which they engaged in the target behavior, and to raise their left hand if they were about to engage in the target behavior but they did not. Awareness training ended when the participant identified 100% of occurrences of the target behaviors in one speech, or at least 85% of the target behaviors among both speeches. The competing response training phase was when the researcher described and modeled competing target behaviors for the participant to use, and these included a 3-second silent pause for any or ah, placing the tongue on the bottom of the front teeth for 3 seconds in response to any time they engaged in tongue clicking behavior, and restarting the sentence without the inappropriate like, when they engaged in an additional like that was not appropriate for the sentence. If the participant did not independently identify an error within 2 seconds, they were prompted by the researcher to do so. Following the competing response phase, there were 2 new topics assigned to the participant, and they drafted out their speeches again. Before their speech began, the researcher informed the participant to use the competing responses contingent on their target behavior. Again, if the participant did not engage in the competing response within 2 seconds, the participant was then prompted by the researcher. Competing response training ended when the participant presented their speech and exhibited at least 80% reduction in target behavior from baseline. A post-intervention assessment was given no more than 3 days following the intervention for each participant. If the participant didn't display at least a 75% reduction from baseline in target behaviors, they were given a booster session, which was identical to the habit reversal training aside from the awareness training portion. And a second follow-up assessment occurred 2 to 5 weeks following the previous post-intervention assessment. Implementation fidelity was assessed in 33% of the sessions and was 100% across participants and phases. Results from this intervention showed that habit reversal training greatly reduced these target behaviors in participants' public speaking. In baseline, participants were engaging in the target behavior for an average of 7.4 instances per minute, which was reduced to an average of 1.4 instances per minute following the intervention, and they were maintained across all participants in their follow-up sessions. In addition to its effectiveness, the habit reversal intervention proved to be an efficient intervention in that all participants exhibited a decrease in their target behaviors immediately after a single session of the habit reversal training, and only 1 participant required the booster session. Social validity was high in that participants' rating for their overall abilities increased from a 2.26 to a 2.97. Participants also reported that they liked the procedures, they found them to be acceptable and effective in reducing their target behaviors during their speeches. Some considerations for this study include the lack of audience, in addition to no generalization probes being conducted. However, due to the impromptu nature of the speeches, it is possible that these results could generalize to a more natural setting. Another consideration is the fact that prior research on habit reversal interventions have applied to behaviors in which a person has the ability to engage in at any moment, like nail biting or hair twirling. So the individuals also have the opportunity to practice the competing responses on a regular basis. If a person is not in a situation where they would be engaging in frequent public speaking, they may not have the opportunity to practice this behavior. Additional research expanding this study, like the 2019 Montes et al. Study, should be conducted exploring generalization to various natural environments and long-term results. As mentioned, public speaking, whether it's to a group of 500 people or to a team of 3 people, is a necessary part of our job. Are you guilty of some of the previously mentioned target behaviors? We want to hear from you. Leave a comment below and let us know what you think. And if you want to help us spread the science, please like this video, share it with your colleagues, and don't forget to subscribe. Thanks for watching.